I start by introducing myself. I let her know I'm a student physical therapy assistant and I get her consent for me to work with her. And then I also verify who she is. Then after I have her lay into supine, I'm going to let her know that we are going to be doing some passive range of motion, testing her knee extension. And then as I am passively putting her knee into knee extension, I'm feeling her end fields. Next, I have the patient sit up so that we can do a general growth strength test on her knee extension. After passively putting her knee into knee extension, I have her do it actively. I'll have the patient keep her knee at about 45 degrees extended, and then I apply pressure at her distal ankle joint towards the ground. Freehand stabilizes her knee, and she scored A5. Next, using my goniometer, I'm going to measure her knee extension. I'm going to make sure to place a towel under her Achilles tendon so that I'm able to measure for any hyperextension. My stationary is going to be in line with her femur, the movable is going to be in line with the lateral fibula, and the fulcrum is going to be right in line with the femoral condyle. Normal degrees of knee extension is 0 to 10 degrees, and my patient had a degrees of 5 for knee extension. So she is in within normal limits. Next, I'm going to be measuring her muscle length of her soleus. So with her standing, her tested limb will be in slight hip extension, 30 to 4 degrees of knee flexion with her heel flat on the floor. Stationary is in line with the fifth metatarsal, the fulcrum at the lateral malleolus, and the movable follows the lateral fibula. Next, I test it with her non-affected leg. For the goniometer, it's going to be all the same landmarks. And then I compare the degrees. For her non-affected leg, she had 65 degrees, and for her affected leg, it was 60 degrees. And then that's going to be or whatever, just go for it. Perfect. And you got that degrees. Okay, you can stop it. So I'm going to be doing a manual muscle test on her medial hamstring. She's going to be laying prone. Her knee is going to be flexed 50 to 70 degrees. Her hip in slight internal rotation and her lower leg slightly internally rotated on the femur. I'm going to apply pressure on the distal lower leg in the direction of knee extension. My free hand is going to be stabilizing the ipsilateral pelvis. And after doing the test, the patient scored A5. I'm going to be doing a manual muscle test on her extensor hallucis longus. The patient's going to be seated, and then she's going to extend the great toe. I'm going to apply pressure against the dorsal surface of the proximal and distal phalanges into flexion. My free hand is going to be stabilizing the posterior calcaneus, and after doing the test, the patient scored A5. The special test that I'm going to be performing is called Ellie's test. The purpose is to assess for tight rectus femoris. So she's going to be in prone, and then I'm going to passively flex the patient's knee. A positive test is indicated by spontaneous hip flexion occurring simultaneously with knee flexion and may be indicative of a rectus femoris contracture. My patient tested negative.